Okay, my name's Pete Van Branken. I'm a veterinarian in Battle Creek, Michigan. I'm here today to talk to you about lumps and bumps. I'm still practice. One of the things I've done is I've sold my practice to some of the people who work for me, but I continue to work there 3 days a week. So I get to see lumps and bumps on dogs. And a lot of these aren't, specifically, these dogs aren't visiting us for lumps and bumps. They're visiting us for a heartworm check or a Lyme check or vaccines. And they're like, what do you think about this? What do you think about that? What do you think about this? What do you think about that? So we look at those lumps and bumps and we touch them and try to figure out what they feel like. And but anymore, you know, and I can be right on almost all these, but I can be wrong on some of them. And we can't have me being wrong or anybody being wrong on some of them. So what we do when we get these lumps and bumps, if the client's willing to do it, we do what's called an FNA, fine needle aspirate. So what we do, we take a brand new needle and syringe and we stick it in the lump or the bump. And we pull cells out and put it onto a slide and try to determine whether it's bad news or good news. A lot of these are going to be what they call lipomas, and those are fatty tumors. You know, quite frankly, when you pull that out and put it on the slide, it looks like somebody spilled a little oil on the slide. And so not all those do we actually go ahead and stain and look at through the microscope, because almost all those are just fatty tumors. Okay, but you need to go ahead and do a fine needle aspirate if you really want to know. Some veterinarians send them out, some do them in-house. We choose to do them in-house. We have very capable technicians, licensed veterinary technicians, who have the time to stain those, look at it, write down what they saw. If they see, now I had one just the other day, and I'm like, well, this doesn't really feel like, about 3 or 4 tumors and lumps or bumps. And we did a fine needle aspirate, and they were all mast cell tumors. That means there's actually a tumor in there producing histamine, which is really a malignant tumor. And so those needed to come out. Now these had been kind of ignored for a while, so they're a little bigger than we thought they ought to be. So we're going to use the drug to kind of shrink those up a tad, and we're going to go ahead and surgically remove those at some point in time. But it's a good thing we looked at that. We don't know where these mast cells are coming from. That's some other stuff. But you know, you get neurofibrosarcomas, you get fatty tumors, you get mast cell tumors, plasma cell tumors. You get all sorts of stuff. But you know what? You figure out whether it needs to come out or whether it doesn't need to come out. But because really, if you let these go way too long, that decision all gets made for you without you doing anything about it. So I think that doing FNAs, and they're lumps and bumps on vaccine appointments most of the time. Sometimes people come in, what do you think of this? What do you think of that? You know, I had one yesterday that actually was on a cat that was a calcifying tumor underneath the kidneys and stuff, and already metastasized to the lung field. Not much I can do about that, but at least this gentleman knew what his cat had and had some idea what the outcome was going to be. Not very good. If we'd have found that earlier, could we have done something with it? Probably not. I don't know how long it had been there. But anyway, and I always say that veterinarians, we sell information and peace of mind, information and peace of mind. Sometimes I'm giving you bad news. I've looked at a tumor on the toe. It's actually a squamous cell carcinoma. We got to take that off, take the toe off as quickly as we can possibly do that. Is that good news? You know what? In some weird way, it's good news, because they came in, they were concerned about something. We figured out was bad, and we're going to try to rectify this and get this toe off before this tumor, this squamous cell carcinoma, metastasized to the chest. So there's still some concern, but the client knows that it's been identified, and now we're going to go ahead and take the appropriate action to prevent this from, taking the life of this dog. So FNAs are good. Like I say, some people send them out, some people do them in-house. I think that however you decide you're going to figure out what they are. And listen, I got Labradors at home. They all get fatty tumors. In fact, if you have a 10-year-old Labrador that doesn't have fatty tumor on it, it's probably not a Labrador. Somebody probably sold you a bill of goods. But we joke about that a little bit. But we've seen a lot of things that were good and just left them the way they were, and those dogs didn't have to have surgery. But a lot of them we've had to take off. So ask your veterinarian if he or she would be so kind as to do a fine needle aspirate on some of these so you can sleep better at night. And quite frankly, that's what peace of mind is sleeping at night. So there you go. That's about all I have to say with this, but that's what a lot of us do, and I think it's what should be done on a lot of the lumps and bumps. Thank you.